Thank you for joining us today. Today's webinar is about the effects of alcohol on physical and mental health and understanding the impact. Brought to you by Prescriptive Health Solutions. Today's discussion will cover several aspects of alcohol, including consumption statistics, physical effects of alcohol, alcohol in men versus women, alcohol and cancer, mental effects of alcohol, alcohol and brain health, alcohol and the effect on the adolescent brain, alcohol use disorder, and ways that you can seek help. Alcohol is considered socially acceptable in the United States, and it is one of the most commonly used drugs. Drinking too much, however, can be harmful to your health. So let's dig in and find out more. So what is alcohol? Alcohol is a clear liquid that can be made by fermentation, distillation, or chemical modification. But it's a drug that affects the body in various ways. When a person drinks an alcoholic beverage, about 20% of the alcohol is absorbed in the stomach, and 80% is absorbed in the small intestine. How fast alcohol is absorbed depends on several things, including the biological sex of the drinker, the concentration of alcohol in the beverage, the type of drink, and whether the stomach is full or empty. What's really interesting to note is that the type of drink, especially carbonated beverages, tend to speed up the absorption of alcohol. But after the absorption, the alcohol enters the bloodstream and dissolves in the water of the blood. The blood carries the alcohol throughout the body. The alcohol from the blood then enters and dissolves in the water inside each tissue of the body, except fat tissue, as alcohol cannot dissolve in fat. Once inside the tissues, alcohol exerts its effects on the body. And depending on the blood alcohol content, it can have a variety of side effects. A person's blood alcohol content can raise significantly within 20 minutes after having a drink. So what is considered one drink? The National Institute on Alcohol Abuse and Alcoholism defines one standard drink as any one of the following: 12 ounces of a regular beer, 8 to 9 ounces of malt liquor, 5 ounces of wine, 1.5 ounces of hard liquor or distilled spirits. Now, when you compare men and women of the same height, weight, and build, men tend to have more muscle and less fat than women. But because muscle tissue has more water than fat tissue, a given dose or amount of alcohol will be diluted more in a man than a woman. Therefore, the blood alcohol concentration resulting from that dose will be higher in a woman than a man. So in essence, women will feel the effects of alcohol sooner than men will. Alcohol is one of the most commonly used drugs in the United States. The 2022 National Survey on Drug Use and Health reports that 221.3 million people ages 12 and older reported that they drank alcohol at some point in their lifetime. What's interesting to note is that more females than males drank from the age of 12 and older. When we look at the statistics of youth aged 12 to 17, 5.7 million people reported drinking alcohol at some point in their lifetime. And again, here the same is true. More girls than boys are drinking alcohol. Physical effects of alcohol on the body are well documented. Drinking too much on a single occasion or over time can take a serious toll on your health. Here are some ways that alcohol can affect your body. Starting with the brain. Alcohol interferes with the brain's communication pathways and can affect the way that the brain looks and works. These disruptions can change mood and behavior and make it harder to think clearly and move with coordination. For the heart, drinking a lot over a long time or too much on a single occasion can damage the heart, causing problems, including cardiomyopathy, which is stretching and drooping of the heart muscle. It can cause arrhythmias such as irregular heartbeat, stroke, and high blood pressure. With the liver, heavy drinking takes a toll and can lead to a variety of problems in liver inflammation, including steatosis or a fatty liver, alcoholic hepatitis, fibrosis, and cirrhosis or hardening of the liver. With the pancreas, alcohol can cause the pancreas to produce toxic substances that eventually lead to pancreatitis, which is a dangerous inflammation in the pancreas causing swelling and pain. This impairs its ability to make enzymes and hormones for proper digestion. Alcohol can also affect the immune system. It can weaken your immune system, making your body a much easier target for disease. Chronic drinkers are more liable to contract diseases like pneumonia and tuberculosis than people who don't drink too much. Drinking a lot on a single occasion slows your body's ability to ward off infections, even up to 24 hours after getting drunk. And even some cancers increase the risk. Alcohol increases the risk of developing alcohol-associated cancers. There are clear patterns emerging between alcohol consumption and increased risks of certain types of cancer. The National Cancer Institute has found that 3.5% of cancer deaths in the United States were alcohol-related. And evidence indicates that the more alcohol a person drinks, particularly the more alcohol a person drinks regularly over time, the higher the risk of developing alcohol-associated cancers. Even those who have no more than one drink a day, and people who binge drink, which is basically 4 or more drinks for women and 5 or more for men in one sitting, have an increased risk of some cancers. And this includes head and neck cancers, esophageal cancer, liver cancer, breast cancer, and colorectal cancers. And of course, there are mental effects of alcohol. As we consider the mental effects of alcohol, we have to look at the association of alcohol and the brain. There is a specific order in which alcohol affects the various brain centers. It starts with the cerebral cortex, then advances to the limbic system, then the cerebellum, then the hypothalamus and pituitary gland, and then finally the medulla or the brainstem. Now, the cerebral cortex is the highest portion of the brain and processes information from your senses. It also initiates most voluntary muscle movements and influences lower order brain centers. The impact that alcohol has in this area of the brain is that it depresses the behavioral inhibitory centers, and it basically causes you to become more talkative, more self-confident, and less socially inhibited. It also slows down the processing of information from the senses, so you have trouble seeing, hearing, smelling, touching, and tasting. Your pain threshold is also raised. Alcohol also inhibits thought processes, causing you to not use good judgment or think clearly. Now, the limbic system consists of areas of the brain called the hippocampus and the septal area, and these areas control emotions and memory. Alcohol causes this system to have exaggerated states of emotion, such as anger, aggressiveness, and withdrawal. It also causes memory loss. Now, the cerebellum coordinates the movement of muscles and controls fine motor movements and balance. Alcohol causes these muscle movements to become uncoordinated. The hypothalamus controls and influences many autonomic functions of the brain and coordinates many chemical or endocrine functions such as secretion of sex, thyroid, and growth hormones through a chemical and nerve impulse actions on the pituitary gland. Now, the effects of alcohol here is that it depresses the nerve centers in the hypothalamus that controls sexual arousal and performance. As your blood alcohol content increases, sexual behavior increases. However, sexual performance declines. Alcohol acts on the hypothalamus and the pituitary to reduce the circulating levels of ADH, which is a hormone. This causes the kidneys to not reabsorb as much water, forcing them to produce more urine. Now, the medulla, or the brain stem, controls or influences all of the body functions that are involuntary, like your breathing, your heart rate, temperature, and consciousness. When alcohol influences these upper centers of the brain, a person will start to feel sleepy and may eventually become unconscious as blood alcohol content increases. If your blood alcohol content gets high enough to influence your breathing, heart rate, temperature centers, you will likely slow your breathing or stop breathing altogether. And both blood pressure and body temperature will fall. These conditions can be fatal. As adolescents mature, they undergo complex developmental changes, especially in their brains. The widespread changes in the organization and functioning of the brain, which continues into a person's mid-20s, brings about the cognitive, emotional, and social skills necessary for adolescents to survive and thrive. Now, the nature of these rapid changes may also increase the adolescent brain's vulnerability to alcohol exposure. Adolescents are more motivated to explore and take risks. These learning experiences, complemented by the adolescent brain's increased ability to readily change in response to experiences, also known as brain plasticity, are key to developing the skills and knowledge to becoming independent. And while this increase in brain plasticity and risk-taking can provide incredible opportunities for learning and personal growth, it also makes adolescents more vulnerable to both the short-term and long-term negative effects of alcohol. People often begin to drink alcohol and use other substances during adolescence. According to the 2022 National Survey on Drug Use and Health, a little over 34% of people aged 12 to 20 reported having tried alcohol at least once in their lifetime. And although adolescents tend to drink alcohol less often than adults, they tend to drink more when they do drink. In fact, over 8% of people aged 12 to 20 reported binge drinking in the past month. Alcohol-related blackouts are often common among adolescents. A study found that 1 in 5 older adolescents who ever drank alcohol reported an alcohol-induced blackout in the past 6 months. More and more research suggests that drinking alcohol in adolescence may have significant effects on brain function. The earlier people start drinking alcohol, the more likely they are to experience a measurable impact on cognitive functions, memory, and school performance over time, perhaps even into adulthood. Researchers have also found that heavy drinking changes the normal developmental patterns in the connections between and within brain regions, and weakens connections between brain areas that regulate emotional and cognitive functioning. So what can we do? The more we know about alcohol affects the adolescent brain, the more we can inform the conversations about alcohol that we have with teens. Parents and teachers play a major role in the way adolescents think about alcohol. Research demonstrates, for example, that children whose parents allow them to drink are more likely to quickly transition from their first drink to unhealthy patterns of drinking, such as binge drinking. Though regular conversations about alcohol, and by parents being a positive role model with their own drinking, parents can shape kids' attitudes about alcohol and set them up to make healthy choices. Alcohol use disorder is a pattern of alcohol use that involves problems controlling your drinking, being preoccupied with alcohol, or continuing to use alcohol even when it causes problems. This disorder also involves having to drink more to get the same effect, or having withdrawal symptoms when you rapidly decrease or stop drinking. If your pattern of drinking results in repeated significant distress and problems functioning in your daily life, you likely have alcohol use disorder. Now, alcohol use disorder can be mild, moderate, or severe based on the number of symptoms you experience. A list of symptoms of alcohol use disorder are listed here. Some of them include wanting to cut down on how much you drink or making unsuccessful attempts to do so. Maybe spending a lot of time drinking, getting alcohol, or recovering from alcohol use. Or maybe it's a feeling of a strong craving or urge to drink alcohol. Or maybe you're giving up or reducing social and work activities and hobbies to use alcohol. Experiencing withdrawal symptoms such as nausea, sweating, and shaking when you don't drink, or drinking to avoid these symptoms, all are signs and symptoms of alcohol use disorder. Many people with alcohol use disorder hesitate to get treatment because they don't recognize that they have a problem. An intervention from a loved one can help some people recognize and accept that they need professional help. If you are concerned about someone who drinks too much, ask a professional experienced in alcohol treatment for advice on how to approach that person. Now, some of the causes and why someone drinks could be genetic, it could be psychological, social, could also be environmental. All of these can impact how drinking alcohol affects your body and behavior. Theories suggest that for certain people, drinking has a different and stronger impact that can lead to alcohol use disorder. Over time, drinking too much alcohol may change the normal function of the areas of your brain associated with the experience of pleasure, judgment, and the ability to exercise control over your behavior. This may result in craving alcohol to try to restore good feelings or reduce negative ones. Now, as we look at various treatments, there are behavioral treatments available. These are aimed at changing drinking behavior through counseling and are led by health professionals and supported by studies showing that they can be beneficial. There is also medication available. There are 3 currently approved in the United States to help people stop or reduce their drinking and prevent relapse. They are prescribed by a primary care physician or other healthcare professional and may be used alone or in combination with counseling. There's also mutual support groups such as Alcoholics Anonymous and other 12-step programs that provide peer support for people quitting or cutting back on their drinking. Combined with treatments led by health professionals, mutual support groups can offer a valuable added layer of support. It is recommended that you start with a primary care physician. So for anyone thinking about any treatment, talking to a primary care doctor is an important first step. They can be a good source for treatment, referrals, and also medication. They can also help evaluate a patient's drinking pattern, or even help craft a treatment plan, evaluate their overall health, and also assess if medications for alcohol may be appropriate or even contraindicated with any other medications that this individual may be taking. More information, there's a hyperlink provided on this page. You won't necessarily feel alcohol's impact on your body right away, but it starts from the moment you take your first sip. Alcohol use can begin to take a toll on anyone's physical and mental well-being over time. Surround yourself with the right people, get the professional help you need, and join a support group if necessary. Thank you so much for joining us today.